Hello lovelies, and welcome to today's video. My name's Alya and I'm so glad you stopped by. Today we're talking about vertigo and headaches. Can my eyes cause vertigo and headaches? So I'll be talking about some of the things that I look out for patients that have these kind of symptoms and the advice I would give to people who have these symptoms. This has been something that was texted through to me or messaged through to me, so as a response to a couple of messages I've received recently. So I'm just going to talk about some of the things that people can experience and what I would do and what I would look out for in their situation. As you can see, the background slowly changing. I'm sort of in the process of just doing things a little bit differently, changing it up. So I can't wait for you to see how it all ends up as well. And I hope you enjoy today's video. Stick around. There's a very specific reason why I wanted to speak about this topic with you guys, and that is because a lot of the time these things can be a comorbidity. What does that mean? So not only are the eyes causing an issue, but perhaps other parts of the head as well. So a lot of the time these type of things can be connected between muscular system but also your balance system. So in the very short summary of it all, not only do our eyes have a lot to do with the way we experience the world, but also our ears have a lot to do with it too, as well as our neck, as well as other sensory features. And many of us fall into a pretty average kind of category, but there are some of us, a small percentage of us, that are potentially a little bit more sensory. So people who suffer from migraines, for example, or people with very acute hearing, or potentially some sort of a sensory loss or disbalance, for example, one ear hears better than the other, or one eye sees better than the other. These will all play a very dramatic role on the way we experience the world. So with vertigo, if it's a sudden onset of vertigo, and even if we are talking about headaches, if it's a sudden onset, the first thing you want to do is rule out any neurological changes. So anything coming from, hormonal changes and all the way through to things like, God forbid, tumors. These are all things that really are quite easy to rule out. Thank goodness we live in an age where we have MRIs, we have CT scans. It's not too difficult usually to organize, for those who have good access, it's not too difficult to organize such a test. Thank goodness, slowly but surely these things are becoming more and more readily available around the world. As the technology ages and becomes less new or less novel, more places are able to have these types of testing available. So thank goodness, it's slow, but it's definitely happening. Even the way we do certain surgeries is most certainly improving around the world, and it's all because, developed countries like Australia are constantly renewing their equipment. Like the major hospitals in Australia aren't going to want to have a 20-year-old MRI machine. So where does that machine go? Somewhere that can't afford a new one, and thank God that means that although it's an older technology, it might be louder, slower, all the different things, at least it's available now to more people, and that is so important. Thank goodness there are amazing organizations around the world, you can definitely Google this, that provide amazing support to the medical profession around the world where money is definitely an issue. So MRIs, or something as simple as a confrontation field test. Now, confrontation field test is one of the oldest tricks in the orthoptic book. What it is you, as a clinician, pretty much sit in front of the patient and you stick your hands out as wide as they'll go, and you'll say, just tell me when you see my finger. And you bring it in, and as soon as the patient says, yep, I can see a finger, you put an X on that specific spot. Same thing the other side, up, down, and usually we do it in quadrants. The reason we do it in quadrants is that's kind of how our sight works. It kind of goes 12 to 3, 3 to 6, 6 to 9, then 9 to 12, and then through the middle. So in that kind of a pattern. But when it comes to hearing, it's a little bit, well, it's outside of my field, so I don't really want to speak too much to it, but it's a little bit more complicated in one sense. But from another sense, it's a bit more of a basic organ, the ear, comparing to the eye. It's a lot more basic. So as long as you have someone who knows how to test hearing or hearing impairments or disbalances, you should be able to get a pretty comprehensive exam without too much equipment or too much of a to-do. Now, as long as you rule out that your ears are fine and it's not your hearing, sometimes you can get these disbalances develop in age or with time. Most things that develop in childhood do become suppressed and don't cause much symptom, unless of course they break down further over time. So one particular one that springs to mind is nystagmus. We all have a natural ability with our eyes to track. So imagine when you're in a train and you're watching the train tracks come by, or both your eyes are going to do this sort of movement as they follow it, as they follow the train track as it disappears into the distance, and then refocus, follow, refocus. And depending on what speed it's going at, it's going to just kind of do this kind of shake. Some people unfortunately experience that due to a breakdown in that system, and their eyes wriggle like that without actually having something to track. So they don't actually have a specific focal point, they just keep on sort of searching. And that's called a nystagmus. And that can most certainly be caused by, for example, a head injury or some sort of minor vascular event, or even some muscle issues in the eyes, and that will most certainly make you very dizzy. Sometimes it's to do with the fluid in the head as well, or the muscles. The brain and eyes are essentially one organ, one entire, so it's very hard to separate the eye from the brain, or vision from the brain. So it's very important to isolate where the issue is coming from. The same thing goes, I guess, for headaches. If headaches are very, very sudden, you also want to do a very comprehensive exam. I don't know if MRIs are necessarily your first step with headaches though, because anything can cause a headache. It could be as simple as a change in diet, or it could be stress, it could be very muscular in nature, unlike the other things that the eyes can present. So as long as you can sort of provide your clinician with a very clear history, they should be able to really understand the origins of what's happening for you, and to prescribe the correct testing based on what's available and what's affordable, but also on what's necessary, because you don't want to go through any unnecessary testings, whether or not they're available or not, and whether they're affordable or not. So assuming it's not something strange like an unexplained headache, assuming it's not nystagmus. The other thing that can be a little bit off balance, or is commonly thrown off balance, is your binocular single vision. Now, I've spoken about double vision on this channel before. This is somewhat related to that, but a lot of people don't actually experience double vision necessarily. What they experience can be just a breakdown in single vision or non-double vision. And that can happen from something as simple as a change in vision to one eye, and the brain isn't able to adapt the two visions, or the two images from the two eyes into one, and as a result you get this, it's really truly a double vision, but it doesn't necessarily present like that in terms of symptoms. Sometimes the symptoms can mask what's really going on. So what you want to do then is present to either your just general health practitioner, or preferably an eye person, whether it's an optometrist, optician, or an ophthalmologist or orthoptist, whoever you have at your disposal there, whoever you can be seen by more quickly, because I do believe that sometimes it can be time sensitive. It doesn't have to be, but it can sometimes be. And the idea there is you get some sort of a static object, can be a pen or can be anything in the world, and you just look at the tip. And I want you guys to watch my eyes as I demonstrate this, so that you can sort of see what the clinician then sees when we do this sort of test. So I'm just focusing on this very tip here, and I want you to watch what my eyes are doing. So if I close this eye, then this eye, then this eye, then this eye, each time continuing to focus on that very tip. Do you see what's going on there? So the eyes kind of switch and focus back and forth, and that's fairly normal. What you didn't see, or at least I hope you didn't see, I'll figure it out when I'm editing this, is that the eyes are turning in an inconsistent or a different amount. Or one eye was more turned undercover and then re-established its normal, or was turned outwards and then re-established its 0 point, or its normal primary position. Ideally you do it with a strong light so that you can definitely see the reflection. And ideally you do it with somebody, or in front of somebody who can discern the difference between what's normal refocusing and what's actually a disbalance or an anomaly. Also, this camera is a bit off to the side of me, so whether that's going to play a role, I'm going to only find out later. But clinically speaking, we do need to see that the eyes focus back on a singular point, and and they don't sort of wander back and forth. If they do tend to wander underneath the cover, there is a good chance that with tiredness, with illness, with alcohol, that wandering is happening willy-nilly on its own, and not being brought on by covering and uncovering, which is actually just dissociating that binocular vision. It's confusing the brain about using the eyes as a pair and causing it to use it one at a time. The other test I often will do, I always will do, so after I've done a cover, uncover, cover, uncover on a patient, I'll also do alternating covers. It really confuses the brain about what you're focusing on, and I do wait for the patient to refocus. For myself, obviously I can tell, but I do wait for refocusing to happen. And then what I can discern is if those muscles are really truly working as a pair all the time, or if it's something that can break down potentially. It's also really important to have not too much change in the vision or in the prescription, and it's also important not to have too much change in the actual acuity or the quality of your vision. That can also be a type of dissociation to the binocular single vision. Binocular, 2 eyes, single vision. Any of these types of things can cause tremendous strain, can cause, as I said, double vision, and if it's strong enough, or if you're one of those people that are sensitive enough, can cause vertigo, can cause migraine, can cause nausea, can cause all kinds of neurological symptoms which aren't even neurological in their nature necessarily. A lot of the time these breakdowns can be an underlying muscular problem from childhood, or it could be something that's just a weakness. Just like anywhere in the body, the muscles can get weaker as time goes on. The eyes can most certainly do that too, and it's actually remarkably common later on in life to get a little bit of a muscle weakness. We see it a lot, especially when someone's had low vision for a period of time, say due to cataract. I don't mean low vision to the point where they can't drive or anything, just reduced vision. And then suddenly we improve that vision. That shock to the system, or that amazing capability of suddenly being able to focus on things, is a little bit too much for these muscles that haven't really been working at capacity for some time, usually a year or so or more, and suddenly they have to be back in full swing. Well, they can't handle it. Luckily though, surgery is possible, glasses are possible, solutions are possible. But to somebody, you can imagine they're in their 70s or 80s and they've just gone through cataract surgery, which was scary enough for them, to then tell them, hey, you actually need more surgery that's less predictable by a different surgeon typically, that mostly operates on kids but he's prepared to operate on you, and it's going to cost you XYZ. They're like, oh, I'll just live with it. So a lot of the time they don't go for it, which is, in my opinion, unfortunate, because they just invested in having amazing sight. They only had it for a short period of time, and they won't invest further into getting it 100% of the way, which it is what it is. So I guess in summary, that if there is any kind of disruption to the head, then the ears and the eyes must be investigated. Ideally, an MRI or CT scan should be performed just to rule out any nasties like stroke, tumour, etc. Definitely do something simple like a confrontation field. You can do that to yourself. You don't need a clinician for that. You just need to prove to yourself that you have roughly 180 degrees horizontal, about 120 degrees vertical of field, and to do it in quadrants ideally. And of course, rule out any other causes. An ear exam is much more available because most general practitioners will be able to perform your basic ear test. Eye tests are a little bit more involved because they require certain equipment, but I highly encourage to do it as quickly as possible. It's not an urgent thing, but it's not something that you can leave for months and months unattended. A lot of the time we just tell people, hey, it might go away. We can't see any big reasons for concern. Let's review in 3 months, and that's cool too. That might all be all it is. It could be just some event. It could be even viral sometimes. It could be your sinuses sometimes. It could be quite basic and quite survivable. But sometimes it can be serious, and any kind of disruption to things to do with the head, to do with neurology, I feel should be seen fairly quickly. Okay, my lovelies, I hope you enjoyed today's video. I just did a quick smoky blue look because, I don't know, feeling like navy today. So I hope you enjoyed. Please comment below any topics about the eyes or general health or other bits and pieces from my crazy world that you'd like me to do a video on. I'm always happy to hear your guys' opinions. Thank you to those who messaged me asking about this topic, and I hope that you found it informative and I answered your questions. For more crazy things about my little world, please jump over to Instagram. Definitely some cuter things out there and fluffier things to look at than just talking about eyes. And if you haven't done so already, please go ahead and subscribe. And let's grow this little channel. I almost forgot my lippy. Wherever you are around the world, I hope you're having an amazing day. I hope that you're staying well and happy, and I can't wait to see you on the next one. Bye.